And our next speaker has a Northern connection as well. Katie Scott is a Senior Patient Involvement Manager in Cancer Research UK, and she's a public engagement and patient involvement specialist. She's worked in the UK charity sector for over 10 years in cancer in relation to prostate cancer, and at Cancer Research UK she leads an increasing patient involvement in her research, and she also gets to live in Banbridge as well, so it must be an absolutely perfect lifestyle. And a lot of people are getting to know that area now through the Game of Thrones and the lovely Strangford Lough. So I'm delighted to welcome you to Katie. Thank you very much.
Thank you. Oh, lovely. Thank you. Well, that's a pretty difficult talk to follow, isn't it? So I hope I'm here to. I've been invited to talk to you about our experience as a research funding organisation, our experience of embedding patient involvement in what we do. To start us off, I wanted to give you a sense of the environment of patient involvement in research in the UK. Over the last 10 years, there's been a trend towards increasing patient involvement in medical research, and I think the National Institute for Health Research should take a lot of credit for that in terms of really embedding the expectation that patients should be involved and collaborated with in the design and delivery and dissemination of research. In the cancer environment, the National Cancer Research Institute has for a number of years had a consumer forum with patient representation on their clinical studies groups looking at different areas of clinical cancer research, which has again really embedded the practice of patient involvement within clinical cancer research in the UK. Amongst other medical health research charities, there's really been a significant uplift in the last 5 to 10 years in terms of the attention that they're paying to patient involvement in research, and that's largely, I feel, been an evolution from a lot of these organisations delivering support services for patients and doing that kind of service evaluation and involving patients, and so the practice of patient involvement has really formed part of their culture, and then they've then taken the next slightly more difficult step of looking at how to involve patients in research as well, and that's really been facilitated in the UK by a group called the User Involvement Involuntary Organisations Shared Learning Group, which is a group of peers, so patient involvement professionals from across medical research charities who come together every couple of months to share practice, develop best practice guidance for the community. And I think when I started in this area about 10 years ago, the Shared Learning Group had just started, and when I joined it was just a lifeline really, because there was no other guidance or support out there. There was no training available to really kind of educate charity sector professionals working on patient involvement in how to do it well. But saying that, when I was a member of that group, it was very noticeable that Cancer Research UK was absent from that group. And actually, Cancer Research UK has been a very, very late comer to patient involvement as a whole. And the reason for that really is about who we saw ourselves as in the past and who we see ourselves as now. In the past, and this represents the kind of brand change that we've had over the last few years. So before 2012, we were a very medical organisation, and we saw ourselves very much as ambassadors of the research community. When we talked to patients about how they saw us, they very much saw us as a cold, inaccessible organisation, and we kind of reinforced that through a lot of our images and our images and storytelling, because we always had researchers in lab coats. That's how we presented ourselves, and so we were very inaccessible for patients. But in 2012 we rebranded, and I think this has been really instrumental in why we've changed so much in terms of patient involvement over the last couple of years and made so much progress towards it, is that when we rebranded, a lot of the insight that we had told us that we needed to change ourselves, and in order to grow and continue to raise money, we needed to be seen as much more relevant to patients today, and they needed to connect what we do with the treatments that they're having and have a much more human face. And so a lot of what you'll see in the way we present ourselves now as an organisation is patient stories, and we talk a lot more about the impact that our work has on patients here today. And in order to achieve that, our kind of executive board identified a need to develop a patient engagement strategy to really bring this to life. And it has 4 pillars. Some of it's about communicating the impact of what we do. Some of it's about improving the way we provide information to patients and do that in a much more personalised way. We're looking at how we're engaging with research participants to improve their experience. But the 4th pillar is all around patient involvement, and that's the area that my team work on. And so we've had this massive strategic commitment backed up with a significant budget to really, really embed patient engagement and involvement in the organisation. And because of that, although we are latecomers to patient involvement, we've seen a dramatic change over the last couple of years in terms of what we're actually doing. So very quickly, how we do involvement, the mechanism I'm sure is probably familiar to those of you that work for charities and do patient involvement. We have what we call our involvement network. It's basically a database of people who have been affected by cancer and want to get involved in our work, and we communicate with them on a monthly basis about the opportunities that they have to influence and shape what we do. So we send them a monthly newsletter, they get a welcome pack. We have our opportunities published on our website so that they're accessible not just to people on our network, but other people who are coming to us organically and want to get involved and volunteer their time to change what we do. And then we also, within that programme of work, have a team dedicated to developing that network. So we have a recruitment and retention strategy, looking at how we keep them engaged and report the impact that they're having back to them, and also looking at how we train and support them to be involved. So I've mentioned we're quite new to patient involvement. We have had pockets of patient involvement activity that have grown up just because particular individuals in the organisation felt it was important, and some of those, the main focus of that was in our clinical research funding committee, where we've had patient representation on that committee for a number of years. But when I came into post, we really wanted to do was just get our house in order. Before we even started looking at how the researchers we fund involve patients, we needed to make sure that what we're doing across the board internally is better, and that we're doing good patient involvement practice before we go and try and influence others to do it. So one of the first steps that we took was to set up a patient sounding board for our Strategy and Research Funding Directorate, and we have an equivalent sounding board for our Policy and Information Directorate. And we've been piloting it for the last year. We had our final kind of end of year session on Friday, and it's been incredibly successful for us in terms of embedding patient involvement practice within the organisation. So what it is a group of 7, but we've just recruited some more, so it will be 12 from next month. But for the past year, it's been 7 people affected by cancer, some of whom have an experience of patient involvement in research and some of them don't. We brought them together, we trained them in the work of our Strategy and Research Funding Directorate, and also trained them in some of the softer influencing skills to kind of make sure that when we put staff in front of them, that we were having constructive conversations about how patients feel about the work that we're planning. They met bi-monthly, but in between that they have e-consultations. And what we've done is in each of their meetings, staff have come along and presented an area of work that they're doing within our kind of strategy and research activity, and consulted them on both their opinions on what we're doing, but also on what the patient involvement should look like moving forwards within a particular project. And when we began a year ago, the consultations that staff were coming with were kind of quite small and discrete projects, and they've now transformed in the last year to being very much larger strategic projects. The most recent being our precision medicine team have brought their precision medicine strategy to the sounding board and looked at how we can have a patient involvement strategy running alongside that. And that's leading to things like a separate patient panel being set up to advise us on how we talk to potential participants in precision medicine studies about what precision medicine is, how we enable informed choice in terms of entering into those studies, but also how we talk to the public about what precision medicine is. So that's one example, but this model has been absolutely, because of the accessibility of the patients for staff, the fact that they meet regularly, the fact that they are a warmer patient audience, means that staff have felt comfortable coming to that group, because a lot of our staff have never done patient involvement before. So it's been really useful as a first step for staff to get their first taste of patient involvement, and usually as soon as they do, they catch the bug and want to do lots more of it. And then, as you'd expect, we also have patient involvement in our committees. We have patient involvement in 4 out of our 12 funding committees. So our clinical and population research committees have had it more traditionally over for a number of years, and that's just been patients sitting on those funding committees. So in our clinical research committee, we have 2 patients on our 2 expert review panels, and then the overarching committee, and in our population research committee there are 4 patients involved on separate groups that meet to help make the overarching committee make decisions about what we fund. But again, when I came into post in the patient involvement team a year ago, we really wanted to look at, are we doing that properly, or are we just being a bit tokenistic by plonking some people into a committee? I don't think we've been completely tokenistic, but I also don't think we were doing it very well. So we've been through a review where we've surveyed the funding committee members, because one of the ways we've influenced particularly senior staff about in favour of doing more patient involvement was to show that the research community actually are in favour of this, and it's not odd to them, and that actually they expect to be doing it, because a lot of the other funders that they're getting funding from are asking for evidence of patient involvement where we're not. So through that process, we showed a strong support from the research community that they want us to be doing, or they expect us to be doing involvement. And the patients that were on our committees, also we brought them together to get their insight, and they've really helped us shape what kind of support and training and resources we need in place to make sure that their involvement is meaningful and focused in the right areas. So a lot of it has been about what questions should you be answering, where do you think you can have the most impact, and that for population and clinical research has really been around the feasibility and acceptability of study design. We also have patient involvement in our Grand Challenge, which is our big new international funding scheme, and I'll talk about that in a second. And most recently, we've set up a patient panel to review our centres and ECMC network. So they've come up for funding again, and so we've had patients reviewing the patient involvement that that our centres and ECMCs have been doing and are proposing to do in the future, and they're kind of proactively working with them now as we go through the rest of the process to really support our centres and ECMC networks to embed and improve the patient involvement that they're doing. I mentioned the Grand Challenge, which for us was a really exciting opportunity to involve patients from the beginning of the creation of a funding scheme, which we haven't been able to do with any of our other funding schemes because they already existed. And so we're fighting against the tide. There's not that much resistance to it, but there are processes already in place, and so it's kind of more of an upheaval to change those processes. Whereas with the Grand Challenge, it is an exciting and innovative new funding scheme that's very focused on delivering patient impact within a relatively short period of time for research. And because of that strong focus on patients, we were able to have conversations very, very early on about how do we involve patients in the process. So we've taken it step by step, and there have been some stakeholders internally who've questioned whether patients can be meaningfully involved in very high-level scientific conversations that have been taking place as we've tried to set the priorities for the funding scheme. But because we took that kind of incremental, step-by-step approach, we've managed to deliver quite a great impact, I think, in terms of the involvement that now happens within the scheme. So the initial ask was just that we had patients involved in setting the priorities for the funding scheme. So there were big consultations, multidisciplinary consultations, to help us identify what should the challenges be? What should we be focusing on for the Grand Challenge? What 5 to 10 questions, if we answered in the next 5 years, would help to make a real difference to cancer patients today? And so we had, in these multidisciplinary consultations, patients present, and so they helped us shape the 7 challenges that we then put out to researchers to submit proposals to tackle. And then because we had won over staff through that process and they saw the value, we gathered feedback from the research community who were present, and they talked about the value that they saw in having patients in those consultations. We were able to set up a patient group who then advised us on what patient involvement should look like moving forwards. And so now we have a patient panel that's been involved in reviewing the initial proposals, and their role is really to shape what the patient involvement looks like in each of the research projects that we then seed funded, and then to review the final 12 submissions that we received and look at the quality of the patient involvement. And the chair of that patient group has now sat on, a couple of weeks ago, sat on the interview panel with those 12 groups to help make the final decision about which challenge we fund. So it's been really exciting for us to be able to see a very holistic patient involvement process. We also have another initiative looking at, in our kind of population research area, where patients are working alongside researchers to help develop funding proposals and then make decisions about which of those proposals we fund. So we run a 3-day regularly run 3-day multidisciplinary workshops with prevention and early diagnosis researchers, and they come together in a workshop of about 25 people, and they again, it's multidisciplinary, and patients are there as experts alongside them to share their experience, to then help shape research proposals looking at how we kind of tackle cancer prevention and early diagnosis. And on the 3rd day, the researchers then pitch their proposal to a panel, and patients are involved in that panel decision, and they get funded. A funding decision is made there and then about which projects will get a small part, about £20,000 of seed funding, that they can then go off and develop their research proposal further and apply to one of our other funding schemes to carry on the research. And what we've seen from that is that the patients that are involved in these workshops sometimes go on to then be involved in the research project moving forwards. We're also looking at how we can train researchers. So I'll talk a bit more about a larger project, but this is what we've been doing to date. So every year our Experimental Cancer Medicine Network brings together junior investigators to kind of over a 2-day networking event where they get support in trial design, and they get advice from senior clinical investigators to help them develop their research ideas. But also within that, we have a patient involvement session that's developed by patients from our sounding board and delivered by them as well. And what that's really doing is embedding patient involvement as a core part of research design practice. And we get very good feedback from the researchers that attend that training. We've run it 3 times now, and they always ask us to come back each year. And then finally, one of the other areas is communications. For me, this is really important, because if we're going to be patient involvement needs to be visible if we're going to show that we are an organisation that listens to patients, takes their views seriously, and therefore is relevant to patients. So in everything that we do, we try and work with our communications teams to make sure that the patient involvement story of a project is told as part of our communication about that area. So the Grand Challenge has been the most successful example of that so far, where we've had, we're in the middle of developing a series of blog posts about the Grand Challenge. So, and the nice thing about it for me, and this is an example here of Terry, who's on the Grand Challenge patient panel, is that it allows us to talk about our research in a different way. So instead of saying, here's research we fund from a very kind of researcher perspective, this is the impact we think it's going to make, we're allowed to put the very human story behind what's it like to be an involved patient. And I think that helps us reach a different audience and connect on a more emotional level about the relevance and value of the research that we're funding. And then there are also practical ways that we're involving patients in our communications, like the development, we've just recently reviewed our animal research policy. We worked with our sounding board and a consumer panel to do that. And now we're working again with a group of patients to look at how do we communicate our new policy in a much more visible way, because we were seen to be kind of hiding it away and too scared to say what our policy is. And we want to be much more open and transparent about what our policy is. So we're working with patients to develop those communications and taking their lead on how we should be presenting that information. So the barriers and challenges we've come across, I mean, I've touched on these. One of the biggest ones at the start was the science is too complicated. How could we possibly involve patients? And so what we've really been doing is trying to work with teams to say, well, and actually the Grand Challenge is a great example of this, where our patient panel turned around to one of our directors and said, but of course we don't want to be making decisions about what's the best science to fund, because you have the scientific expertise. We're here to make sure that patients are represented in that research. So we don't want to trump your expertise. We want to add to it and enrich the process. And so a lot of the conversations that we have now are about, with teams across the organisation, are where is this going to add value, and what questions do we need to ask patients to answer questions that we wouldn't otherwise be able to answer, to add that evidence alongside all the other evidence and expertise that we bring into our decision making. The second bit is relevance. So a lot of our staff, because they've never done patient involvement before, just don't understand how it's relevant. And I'll talk about practically how we overcome that in a second. There's also an issue around confidence. A lot of us, again, because they haven't done it before, they don't feel confident, and they worry about walking into a room full of patients and either being shouted at or patients getting very emotional and staff not knowing what to do about it. And you know, if you think of the typical makeup of the charity workforce, it's young females who maybe just don't have the confidence to be able to manage those situations. And so we're quite keen. We have we do a lot of work around kind of just upskilling and building confidence within our workforce to feel okay to do patient involvement. The next one is about staff coming to us far too late. So because we have a network and a patient sounding board, they think that they can come to us a week before they need an answer to something and that we can do good involvement. They want a focus group with a hard-to-reach group. And so we have to do a lot of work educating them about actually how long it takes us to recruit patients to some of these activities. And then the final one is about how do we inspire patients to get involved. So there are the typical, as I'm sure you've all got experience of, the typical type of informed patient that seeks out this information and seeks out these opportunities to get involved, but they aren't the only people we should be listening to. And so we have to think strategically about how do we talk about our patient involvement opportunities so that they seem like they attract people to them, so that we are giving them the opportunity to influence something that they want to influence, and then how do we reach harder to reach groups. So in terms of how we're overcoming those, the language that we use has been really important. So we have had to talk a lot about value-adding patient involvement. So making sure that staff understand that we're not doing it for the sake of it. We're not doing it just because we've got this strategy and we've been told that we have to do it. That we're being really clear from the start and working with staff to really carve out the objective for each patient involvement activity so that it is value-adding. And that we need to do that anyway, because that means it's then meaningful for the people that we're involving and that we can report back on the impact that they're having. So that helps to overcome the tokenism. We have a member of staff in our team who is dedicated to our internal culture and changing our internal culture much more in favour of patient involvement. So she delivers staff training, and so initially that was just an introduction to patient involvement, and it's now much more broken down into some of those areas like building confidence or facilitation skills. So it's much more kind of practical. Our sounding boards have been fantastic, as I said, about giving staff their first taste, particularly staff who aren't confident. So we give them, the sounding board is a nice way for them to come and deliver a consultation with patients and build their confidence in doing that. we also have a big piece of work that I'm leading looking at how we evaluate the impact of what we're doing, which we've by no means solved, but we are putting mechanisms in place now to look at how patient involvement is improving the quality of what we do, the impact that we're having on patients, the impact that it's having on kind of patient advocacy of us as an organisation, and the impact that it's having on staff in terms of upskilling them, but also motivating them and bringing them closer to our cause. And we are consulting patients, so we're working with patients to review our opportunity adverts, our role profiles, our involvement network materials to make sure that we're talking about patient involvement in an engaging way. And then very quickly, as I said, we've been looking in-house at are we doing patient involvement properly, and I think we've got to a point now where we feel we've made enough progress. There's still work to be done, but we've made enough progress to start looking externally at what the researchers we fund are doing. And we fund something like 4,000 scientists, nurses and doctors across the UK, so that's a big audience for us to be working with. So we've been asking them what they think the barriers and challenges are, and as you can see from here, about 50% don't even really understand what patient involvement is, so there's a big knowledge gap that we can be filling. And then there's some practical issues around not having the budget, not having the time, not knowing how to find people to involve. So for me, that just gives us some really clear instruction about what we need to be doing to overcome that. So even though there are those barriers, we have found that there is still a strong inclination or willingness to do patient involvement. So our funding committee members were unanimously in support of patient involvement, and Cancer Research UK delivering or including patient involvement as kind of common practice. And we know that there's an appetite from a survey we did of some of our researchers for training, and what they want is bite-sized training that often can be accessed online, so that it or short sessions, kind of couple of hour sessions, so it doesn't take up too much of their time. So from that, we're developing a strategy for how. Sorry about the slides all over the shop, but a strategy for how we work with the research community, and we're looking at how we incentivise, empower, facilitate, and reward them. So incentivising them is really about communicating the impact and the benefit that it could have in their work, and we're also looking at our funding schemes and whether we can actually put patient involvement within our terms and conditions of some of our funding grants, but that's a work in progress. And then empowering them and facilitating is really around providing resources, and making sure that researchers are really clear about what expectations we have of them in terms of patient involvement. And then in terms of facilitation, it's about giving them access to our involvement network. So we really need to grow the number of patients that we have on our database who want to be involved, so that we can make that network accessible to the researchers we fund, so that we can kind of close that gap for them, and then provide resources and guidance for the research community so that they're doing patient involvement in a way that meets kind of best practice standards. And then around rewarding is about recognition, so it's about benchmarking what our centres and ECMC networks are doing, so they can see what how they can compare themselves against each other, and we're also developing an award scheme to recognise researchers who are doing fabulous patient involvement. So the future for us really is building on this. So we're looking at how we develop our website so that we have a kind of patient collaboration and involvement hub for researchers within the kind of researcher zone on our website. Evaluation and showcasing the impact of patient involvement will be a big priority moving into the next quarter. We're optimising the patient journey, so I talked to you about the kind of retention and recruitment of our involvement network. So we want to make sure that if we're involving people, we don't kind of lose them afterwards, as well as continue to grow new membership. We are going to be developing a lot of video content because we feel that a lot of our network don't actually feel that some of the opportunities are right for them because they don't have the right experience for those activities. So we want to develop a series of videos that help to kind of humanise a focus group or a patient panel and show that it isn't this big, scary, daunting thing, and that it's actually there for everybody to get involved in, and that we will support people to get involved in those types of opportunities by providing induction and training and resources. And we're also running specific training for our involvement network on patient involvement in research, which is a very simple, it's not simple, but basic introduction to what patient involvement in research looks like and why we do it. So we've been testing that with some other medical research charities, and next year we'll be looking at running that on our own for our network. And that's everything, I think.
Thanks, Katie, for a really comprehensive and one of the best presentations I've heard on a holistic or multidimensional or systemic approach to PPI, I would call it, in terms of all levels of the organisation, involvement network, the images you use, the patient sounding board. I mean, there's loads of really positive strategies as well as conceptual ideas that I think many people here will work through. But just time for a quick question to Katie before the next speaker. Just if you'd introduce yourself, if that's okay.
University College Dublin. Katie, that was inspirational and well done. Absolutely amazing what you've been able to do. Difficult question, but ballpark, how much money do you think it takes to get something like this started, and how much to maintain it? Difficult question.
Well, not as much as we thought is the answer. So we had quite a significant budget, and I think so far this year, I mean, we've spent under £10,000 on the involvement in research side within my team, excluding staff salaries. So it's not been a huge amount, but what we have had the budget there, and what we've had to say to staff is, because they're not budgeting for it, so because they haven't included it in their business planning to date. So we, as we approached business planning last year and as we approach it now, we're saying to them, please budget for it, but generally they aren't. So we have a pot of money that we offer to staff to cover things like travel expenses, and we also we have a reward and recognition policy, which means we offer an honorarium to patients that get involved. So it's about £30 for a half day and £80 for a full day activity. So that's the most, aside from staff costs, the most expensive cost, and particularly because we want to be inclusive. So we will fly people from Northern Ireland or Scotland to London, or we run events across the country. It's not, we try not to be London centric. Our events are often in London because it's actually the easiest place for everybody to get to. But so that's the largest cost. But I think. And what we say to our researchers, so we have guidance for the research community on patient involvement in our kind of costings guidance to help them budget when they're developing research applications. So we ask them to budget for it and budget in line with our reward and recognition policy, so that our money is being spent in a consistent way, regardless of whether it's through a research grant or directly from us centrally. Does that answer your question? Okay.
Thanks a million. Thanks, Amelia. Just again, if there's further questions, please keep them. We'll email them to Katie, and we'll share the responses if that's okay.
Yeah, and I'll be around.
Just in terms of we're a bit under pressure in time. So thanks a million again.